For being aware in the instant from this and other information, don't forget to subscribe to our channel. "40 Americans being taken off the quarantined cruise ship Diamond Princess are infected with new coronavirus," a U.S. official says. They are among 400 people from the U.S. leaving the vessel docked in Japan. Most are due to depart for the U.S. on 2 government-chartered aircraft. But those carrying the virus will be admitted to Japanese hospitals. Meanwhile, China has tightened restrictions on movement in Hubei province, the center of the outbreak. What is happening on the cruise ship? The Diamond Princess has been quarantined in Japan's port of Yokohama with some 3,400 people on board since the 3rd of February after a man left the ship in Hong Kong and was found to have the virus. It has the largest cluster of coronavirus cases outside China. The Japanese authorities on Sunday said the number of new cases on board the ship had risen by 70 to 355. The 40 Americans who are infected will receive medical treatment in Japan, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, told Face the Nation on CBS. Others are going to be evacuated, starting imminently, to Air Force bases in the United States, he said. If people on the plane start to develop symptoms, they'll be segregated within the plane. Those entering the U.S. will undergo a 14-day quarantine, on top of the time they have already spent confined on the ship. And the reason for that, Dr. Fauci added, is that the degree of transmissibility on the cruise ship is essentially akin to being in a hotspot. Some of the Americans have declined to be evacuated by plane, preferring to wait until the ship quarantine comes to an end on the 19th of February. Passenger Matt Smith, a lawyer, said he would not want to travel on a bus to the plane with possibly infected people. Other evacuation flights will repatriate residents of Israel, Hong Kong and Canada. What are the new Hubei measures? People in the province of 60 million have been ordered to stay at home, though they will be allowed to leave in an emergency. In addition, a single person from each household will be allowed to leave the building every 3 days to buy food and essential items. On housing estates, one entrance will be kept open. It will be guarded to ensure that only residents can enter or leave. All other businesses will stay closed, except chemists, hotels, food shops and medical services.